friends, this is Dr. Sameen Afzal Junejo. Today I will show you a phaco surgery in which I have very clearly highlighted the direction of the phaco handpiece. In this case, I have used the cystodome to surgical limbus. As you see that the cystodome is inside the anterior chamber. A round curvilinear anterior capsular axis is being created by moving the cystodome tip on the anti-clockwise direction. The rhexis is completed. Cystodome is removed. And now I will do the next step of the phaco surgery, that is to inject the OVT disperser in order to deepen the anterior chamber and build up the intraocular pressure for the full thickness corneal incision to be given. And now I am using a 2.75mm diamond knife and a 2-step corneal incision is being given to surgical limbus at upper temporal quadrant of the cornea. And then I will again give 2 incisions, one at 3 o'clock and the other at opposite side approximately 8 o'clock. These are the side port incisions. The 2 side port incisions are approximately opposite to each other and negate the astigmatism against the rule, or the astigmatism which is in the temporal meridian. Hydrodissection is being performed by means of hydrodissection cannula. All beneath the rim of the anterior capsule, and the nucleus, which is about 2 to 3 in density, is completely mobilized in the bag. Hydrodissection and delineation are done, and now the important aspect is being started. You can see that I will introduce through the corneal incision the phaco tip along with the sleeve. Before that, by means of a side chopper, I will push the nucleus down, expose the equator at 12 o'clock position, engage the phaco tip at the equator of the lens nucleus, and start biting at multiple quadrants of the equator of the nucleus. In this way, once you catch hold of the equator of nucleus, then there is no work to be done. I have turned the phaco tip with the bevel on the side, neither downwards nor upwards, it is on the side. When we keep the bevel of the phaco tip on the side, laterally or medially, the phaco energy is not being transferred to the endothelium of the cornea, and the corneal endothelium is completely saved of any insult due to the release of phaco energy, and patient will no more develop the endothelial dysfunction. As you see that within 1 minute, 1.5 minutes, the phacoemulsification is completed, and now the OVD disperser is being injected to do the irrigation and aspiration by means of a two-way Simcoe irrigation and aspiration cannula. Before going for this step, it is very important that the anterior chamber, including the bag of the capsule and the cortical matter, are being completely lubricated by viscoelastic solution. And now the cortical matter along with the methyl cellulose being removed, and the bag is being completely emptied. Side ports are being used to remove the cortical matter. After completion of the irrigation and aspiration of the cortical matter, viscoelastic is injected, and now the intraocular lens will be implanted. the significance of keeping the phaco tip with the bevel at either side is actually to save the corneal endothelium from getting burnt by the phaco energy. And now, with the help of injector, the intraocular lens is being implanted in the bag. This is a one-piece hydrophobic preloaded intraocular lens which is being implanted slowly and gradually into the bag. Lens is being dialed in the bag and properly positioned with the haptics in the vertical direction, so that there should be no any further movement or manipulation of the lens or tilting of the lens after the surgery is completed. Because if the haptics are placed horizontally, there are chances that the intraocular lens, due to any jerk, may tilt and can give rise to oblique astigmatism, which again becomes the problem for the patient. And now the viscoelastic solution is being removed by means of simple irrigation and aspiration calendar. Lens is a little bit lifted up and the viscoelastic solution removed behind the lens optic or in between the lens optic and the anterior surface of the posterior capsule. Because if the viscoelastic solution is trapped in between the lens nucleus and the posterior capsule, patient might develop transient rise of intraocular pressure, postoperative cellular reaction in the anterior chamber, and sometimes, very rarely, the patient can develop endophthalmitis. So it is very important to irrigate the viscoelastic solution completely after the implantation of intraocular lens in the bag. Now I will inject a cocktail of the antibiotic, steroid and pilocarpine in the bag and complete the procedure. Thank you very much. Dear colleagues, if you like this video, please subscribe my channel, like it and push the bell icon so that you can very easily and comfortably receive my uploaded videos in future. Thank you.